What I want you to see is this is April 1st, the wound, and here with our ability to do miracles, it's completely granulated, completely healed. This is the treatment that I want to provide for everyone without any downtime. Where you see the red, that's already the wound that's granulated. The skin is basically done, except now you have to have the hard part of the skin covering it, the upper layer of the upper layer. So that is the granular dermis and the orthokeratotic part of the layers of the skin. But this is it, this is already granulating. So what we're doing first is we're putting the Sylvidin around. The reason we're putting the Sylvidin around is we want to make sure that there is a border there that will prevent the fluid, if it leaks out, from leaking outside. Sometimes we put beta blocker to help, and we put some Exosome drops, but in this case we did it without it. Pimatoprost drops we use, divided a 1 cc into 5 syringes, all 1 cc, diluting it with plain saline without any preservatives inside, so it will not break the cell wall, because if you have it with the alcohol, as it's usually found in the normal saline vials, it will denature the lipid layer of the exosomes and it will not be able to deliver its cargo. It will simply be lysed and the efficacy will be questionable or reduced. And now we're going by a circle around the area and then into the area. Now once we're done with that, we're going to go ahead and put the aquaphor. We're taking the aquaphor from the jar and we're going to put it right on top of the telfa and spread it out over it. The idea is that you want to keep the area moist to mimic the normal action of the epidermis by creating a barrier that keeps the moisture. As we know, 80% of the skin is water. Without it, it will dry and dehydrate. So now that this is there, it doesn't really hold well. We're going to wrap it up her entire head, and you'll see we'll do that in a sitting position, because otherwise it comes off, and even with that it comes off. It's very difficult. Doesn't matter how you bandage it, because of the hair, it ends up slipping, sliding, and so this way you lose the entire graft. Also, sometimes I see infections from the fact that it's there constantly covered for 7 days. Not common, but I've seen infections happen this way. So it's better when you're constantly changing and cleaning it with Vashi, which is the hypochloric acid, to disinfect it before you reapply the treatment.